Imagine you seriously hurt yourself and you have to go to the ER. You walk into the waiting room and it's pure commotion. A gunshot victim is being rushed through the doors, as doctors frantically run around as they sprint to save a life. In the corner, a family is shattered, breaking down after hearing devastating news. And the only thing you can hear the whole time is the sound of other patients coughing, sneezing, and blowing their nose. This will clearly cause you a lot of stress, making you very anxious and very worried. Anxiety will always come when you have to visit the hospital, but there are ways to reduce it, and that's what I'm here to talk about today. How to improve the overall patient experience from the time you enter the hospital to the time you leave. My family and I have had our fair share of encounters with hospital visits, such as when I fell off the monkey bars and broke my tibia bone, and the very next day, my grandfather fell in the driveway and dislocated his shoulder, and then many, many other times. And sometimes, the doctors that have taken care of us have not always been the kindest people. Very few events in life make us as vulnerable as when we have to turn to another human for help, especially during sickness. It is very important for physicians to remember this in order to do justice to the plea of a patient. Okay, now imagine you're back in the waiting room. You're watching all of this chaos go on when finally your name is called. If you know anything about Grey's Anatomy, you know you want to be called into a room where a doctor like Derek Shepard or Christina Yang is standing in front of you. But instead, you get called into a room where a doctor such as Owen Hunt is standing in front of you. While Owen is a very talented doctor, he is often egotistical and overly proud of his work in front of his patients, indicating he has poor bedside manner. Proper bedside manner isn't just nice to have. It's a critical part of the patient experience. This is how a doctor approaches you, not just as a patient, but as a person. Someone they need to connect with, listen to, and treat with respect. We all know the saying, treat people with kindness, but it's especially important for doctors to remember this when you're putting your life in their hands. One way we can understand the depth of bedside manner is through a prayer written in 1793 by a German physician named Marcus Ayers. He wrote, "O God, let my mind be ever clear and enlightened. By the bedside of the patient, let no alien thought deflect it." This shows that when a doctor is at your bedside, their only focus should be on your well-being. It's not about their knowledge or their authority, it's about you. It's about understanding your needs and offering care that's focused on your comfort and your humanity. But as we know, this isn't always the case. Some doctors feel as though they can't focus on diagnosing you while also trying to appeal to your emotional needs. Between 2021 and 2022, the American Medical Association found that 40% of physicians wanted to leave their current position due to high patient expectations. Balancing skill with compassion is very difficult for some doctors. So how can this be addressed? How can future physicians be trained to have this responsibility? One powerful way is through simulation. Many medical schools have started hiring actors who are trained to portray real patients. They come in and have a real doctor-patient interaction just like any of us would. These kinds of exercises can help doctors practice their ability to connect and their communication skills. I had the chance to experience this firsthand at a Health Occupation Student Association's event. They presented us with an animatronic patient that had real emotions just like any human would. If you were rude to it, it would show resentment, it could even cry. But if you were nice to it, it would show joy. This was a powerful way to remind us all of the impact that our actions have. But let's not forget, trust in medicine is also about competence. Trusting that the doctor will give you the proper treatment and the proper diagnosis. The heartbreaking case of William Bryan, who underwent surgery to remove his spleen, but got his liver removed instead, leading to his death, is a case that obviously caused a break in trust for many patients, making them question if they really can trust their physicians. But don't worry, you can, because steps are being taken to address these kinds of errors. For example, hospitals have introduced a protocol called timeout. This is where, before any procedure, the entire medical staff takes a short pause to make sure they have the correct patient, the correct body part, and the correct operation. This can make you feel more protected when you go into surgery. I think hospitals should take it even further. I think hospitals should implement systems that allow the entire medical staff to speak freely, without fear of retribution. In the William Bryan case, we can see that nobody in the hospital room spoke up, due to the fear of consequences that would come when you question the lead doctor. If hospitals want to ensure our safety, they need to implement systems that allow the entire staff to speak freely, look out for one another, and ultimately to protect the person that matters most, you. When we think about the patient experience, it's also essential to remember that not all patients are going to speak the same language. Imagine the discomfort a patient must feel when they can't understand their doctor's instructions, or worse, when they can't communicate their symptoms. This will have a profound impact on how they feel during their visit. I'm going to share with you some findings found by a study conducted by Harbor-UCLA Medical Center. They interviewed patients who were either English or Spanish speakers visiting the ER. Once the patients were triaged, they saw the first available physician, regardless of their language preference. A week later, patients were followed up for contact to gauge how they felt during their visit. The results were as you would expect. English-speaking patients had no problems with their visits, reporting high satisfaction levels. Spanish-speaking patients, on the other hand, reported lower satisfaction levels, especially in the doctor's friendliness and understanding of them. They felt that because of their language differences, they were being ignored and neglected. So what can be done about this? First and foremost, hospitals need to make sure that they have a balanced and diverse medical staff. This way, all patients can be paired with someone they feel the most comfortable with. Providing access to interpreters can be very helpful. If interpreters aren't available, having tools such as a medical dictionary or a translation app nearby can be very, very helpful. Last summer, I had the chance to shadow Dr. Leo Blaze, an internal medicine doctor at Baton Rouge General. One of his patients had come in and told him that he took a fall in France. He had to visit the doctor there, and all of his instructions and treatments were given to him in French, so of course, the patient didn't understand them. Thankfully, I had my phone in my pocket and was able to take it out and use the translation app and send the patient on his way. This shows that having a simple tool like this can make that much of a difference. On the topic of communication, let's talk about how communication with patients is not only important, but also with our families. Patient and family-centered care is the cornerstone of effective communication, especially when we face the most difficult part of healthcare, when a patient passes away. Imagine your grandmother fell and you had to take her to the hospital. The lead doctor on the case approaches you and asks what happened. In as much detail as you can, you tell them what happened before she fell, what happened on the way to the hospital, and the whole time, the doctor just stares at you blankly. As soon as you're done talking, the doctor bluntly tells you that your grandmother has passed away, and with no explanation, gets up and walks away. This is clearly not the experience anyone wants to have, but unfortunately, my friend Riley had this experience a couple weeks ago. As I'm sure many of you feel, I felt that this was a very inhumane way to go about this. So what should you expect if someone in your family passes away? You shouldn't expect the doctor to come and break down with you and your family, but you also shouldn't expect them to approach you with an overly positive attitude, saying something such as, well, they're in a better place now, because this will just make you feel worse. You want them to approach you with a level of composure that allows them to be strong for you and your family. You're going to want them to answer questions honestly and directly, even when the honest and direct answer hurts. But above all, you want them to approach you with empathy. Dr. Fatlett, a pediatric surgeon at the University of Louisville, put it simply: we as surgeons need to be more empathetic to understand how our patients are feeling. When doctors take time to communicate and build this trust, we feel as though we're not just dealing with a healthcare provider, we're dealing with someone who truly cares. In the end, it's all about balancing the needs of modern medicine with the timeless need for human connection. Doctors need to be trained not just in clinical skill, but in empathy. They need to remember that we patients are not just cases to be solved. We're human beings deserving of kindness, respect, and care. And this starts with the doctor-patient relationship, a relationship built on trust. Thank you.